Ladies and gentlemen in many parts of the world, good afternoon, or as may be the case, good morning London and good evening Seattle, USA. Welcome to our international webinar, Delivering Social Assistance During the Pandemic, Lessons from Indonesia. Please allow me to introduce myself. My name is Ririn Agustarini and I will be your MC today. This webinar today is hosted and organized by Microsafe Consulting in collaboration with Inka Maris and Associates Consultants and is co-hosted by the Ministry of National Development Planning and the Ministry of Social Affairs of the Republic of Indonesia and supported by the Bill and Melinda Gates Foundation. The webinar aims to facilitate a dialogue and exchange of best practices with regards to the delivery of social assistance programs during the pandemic with Indonesia as an example of a success. We welcome and thank everyone for attending our webinar today. On this very occasion, allow me to welcome Dr. Andes Pungki Sumadi, MCP, PhD, Deputy Minister of National Development Planning for Population and Employment of the Republic of Indonesia, Dr. Michael Wigan, Director of Financial Services for the Poor, the Bill and Melinda Gates Foundation, Mrs. Satu Kahkunen, the World Bank Country Director for Indonesia and Timor-Leste, Mr. Graham Wright, the Group Managing Director from MSC, who will moderate the webinar. I wish to convey a message from Minister Juliari Batubara that regretfully he is prevented to join our meeting due to unforeseen circumstances. However, he sends a warm welcome and with panelists a lively discussion, especially welcoming a good friend, Michael Wigan of the Gates Foundation. Minister Juliari has delegated to his knowledgeable and trusted expert staff for social welfare technology, Mr. Andi Dulung, PhD. Ladies and gentlemen, before commencing with the program of the day, may I have your attention for Indonesia's national anthem, Indonesia Raya. Ladies and gentlemen, International Webinar Series, Delivering Social Assistance During the Pandemic, Lessons from Indonesia showcases Indonesia's success and is a forum for sharing and learning of ideas and experience. To begin our webinar today, the keynote speech from Minister for Social Affairs of the Republic of Indonesia will be delivered by Mr. Andi Dulung, PhD, expert staff for social welfare technology. Bapak Andi Zainal Abidin Dulung, PhD, is the expert staff for social welfare technology of the Ministry of Social Affairs of the Republic of Indonesia. In his previous position as the Director General for the Poor, his ideas drove social assistance programs such as the Cashless Staple Food Assistance Program, Group Small Enterprises or KUBE, housing rehabilitation for the poor, and environmental infrastructure programs. Ladies and gentlemen, we now invite the Ministry of Social Affairs expert staff to deliver Minister Juliari Batubara's keynote speech. Mr. Andi Dulung, the stage is yours.
Thank you. From Jakarta, good afternoon, ladies and gentlemen, and thank you for welcoming to this imperative event. And my friend, Dr. Pungki Sumadi, Deputy Minister of National Development Planning for Population and Manpower Republic of Indonesia, Ms. Satu Kaukonen, Country Director for Indonesia and Timor-Leste World Bank, Mr. Michael Wigan, Director of Financial Services for PU, the Bill of Melinda Gates Foundation, Mr. Graham Wright, Founder and Group Managing Director, Microsoft Consulting Global, and distinguished participants. First of all, I would like to express my sincere gratitude, appreciation to Bill and Melinda Gates Foundation, World Bank, Microsoft Consulting Indonesia for hosting this meeting. As you know, my name is Andi Zainal Abidin Dulung, Senior Advisor to Ministry of Technology, of Social Welfare, and I would like to presenting the Ministry of Social Affairs, His Excellency, Mr. Juliari Batubara, that convey his sincerely apologize for not being able to attend for meeting today. It's been an honor to be among such accomplished individuals and to be able to present Ministry of Social Affairs perspective on the topic before you all. Distinguished delegate, ladies and gentlemen, allow me to deliver the remark from the Minister. The COVID-19 outbreaks demand modification to public policy system in order to put society back on the track and achieve long-term resilience to face future unexpected uphills. Indonesia made significant achievement by reaching the milestone of single-digit poverty rate 9.8% at the national level in March 2018. Yet, due to the pandemic, there are concerns on rising up of poverty rate and reverse years of positive votes. National Ministry of Development Planning has projected that if the rate of economic growth slowly to zero, the poverty rate will reach 10.5%. With million people are predicted to fall below poverty line. The Indonesian government has responded in swift, careful, and integrated manner, is better prepared in alleviating the social impact of COVID-19 from harming the citizens. The two established national task force, the COVID-19 Response Task Force and the National Economic Recovery Task Force, shows that the high level of government's attention to the matter by leveraging agency that has great public trust, vast assets, and a network across the country to mobilize all resources in responding to COVID-19 and accelerating economic recovery. The national and sub-national government has pledged to channel Indonesia rupiah 950, sorry, 695.2 trillion, or equivalent to 47.9 billion USD from the state budget, 78.2 trillion rupiah, or equivalent to 5.3 billion from regional budget, and 31.8 trillion, equivalent to 2.19 billion of village fund into the COVID-19 response fund in 2020. Distinguished ladies and gentlemen, Ministry of Social Affairs and its existing social protection measure have been putting a worthy of effort on targeting poor individuals and families, reduce the poverty rate, and responding to disaster reasonable fast. The government of Indonesia have data terpadu kesejahteraan sosial, or we call it DTKS, integrated data on social welfare, Indonesian Social Registry, as a robust system for social protection delivery, including identification and selection of beneficiaries, payments, and for monitoring program performance through digitized data and information systems. To mitigate the social economic impact during the pandemic, we increase the benefits of program Keluarga Harapan, expand the coverage of food stamp program through Sembako program, including 16.04 million targeted beneficiaries, and with Bantuan Presiden, distribute in kind and cash assistance, mobilize social welfare pillars, supporting emergency relief and personal protective equipment, provide counseling services and psychology support, and conduct capacity building for program facilitators. All programs prioritize for the poor, the new poor and other vulnerable group, especially the elderly, women with low income, person with disabilities, and informal worker affected by the pandemic. Distinguished delegates, ladies and gentlemen, due to the pandemic, there are a greater demand to make social protection measures more adaptive to emerging risk and vulnerabilities, including leveraging existing delivery system and expand the coverage. The major challenges are not only targeting accuracy, identifying the appropriate beneficiaries for the social protection measure, but also avoiding overlap in disbursement. DTKS must immediately function as a provision database with regularly validated the citizen socio-economic status, so that the government have reliable information to determine on which individual and families entitled to receive social protection benefit from the national and subnational governments, and to support the rapid expansion and long-term resilience impact of social protection program. The experience of social safety nets in responding to pandemic in Indonesia offers certain lessons to our public service delivery that are: first, social protection measure will continue to remain critically important in the medium term. We need to continue to support. We need to ensure that COVID-19 social safety nets work effectively and efficiently. Having said that, developing an effective targeting mechanism and expand investment on unified database for better targeting is a priority. Investment in the sector is expected to produce valid, integrated, inclusive, and disaggregated data on social welfare. Learning from previous policies, we maintain close coordination among national ministry or agency and subnational government to efficiently manage existing cash assistance and other safety net schemes, such as those intended for poor farmer, fishermen, and rural poor, as well as reassuring subnational government to actively updating DTKS for better targeting. Second, at present, the COVID-19 response have been focused on social assistance and social insurance, with limited intervention with respect to social care services. In the medium term, we'll need to strengthening institutional capacity, including in terms of adequate and well-trained human resources to deliver benefit and social care services. Engagement with other relevant stakeholders, providing social care and services should also be organized. Third, expand social protection systems and make the system more responsive to the future crisis will be important component of the recovery phase, helping economy to build back better and as well as building resilience of the people. Indonesia determined that the platform of comprehensiveness and adaptive social protection become one of the prioritized national development agenda for 2019-2024. And the last, it is vital to push toward digital solution in the social protection delivery. Digitalization social assistance is expected to address challenge in terms of communicating entitlements, distributing cash or food due to limitation of movement and large gathering, and reaching geographical isolated areas. Ladies and gentlemen, all these future policies are expected to boost our resilience, to reform social protection program when needed, and to make innovation. Thank you and have a good day.
Thank you, Mr. Andi Dulung, and congratulations for your ministry's success in delivery of social assistance to millions of Indonesians. May we take a few moments first for a photo opportunity. For speakers and moderator, please turn on your camera. So we would like to ask Mr. Andi Dulung, Mr. Pungki Sumadi, Mrs. Satu Kahkunen, Mr. Michael Wiegand, and Mr. Graham Wright to please look at the camera and don't forget to smile. 1, 2, 3. Thank you. Yes. Thank you so much.
Thank you.
Ladies and gentlemen, we will move on to begin a high-level panel discussion. For questions from the audience, there will be an opportunity to ask questions after the discussion. For information, may I remind you, for questions, please use the Q&A menu at the bottom of Zoom. Type your question in the following format: your name, addressee, your questions. Only selected questions will be asked by the moderator. For those who need interpretation service from English to Bahasa and vice versa, please click the interpretation icon or globe image at the bottom right of your screen. And now we would like to invite Mr. Graham Wright, Group Managing Director, Microsafe Consulting, as the moderator. Graham Wright is the founder and Group Managing Director of Microsafe Consulting. He pioneered much of the core of market-led approach used by MSC. He has around 30 years of experience in emerging markets in countries in Asia and Africa, underpinned by 5 years of experience in management consultancy, training and audit with Arthur Andersen in Europe. Mr. Graham Wright, the panel discussion is yours.
For joining us. It's very, very kind of you to join us on this Inspiration, Insight and Learning webinar, the third we have after the ones on Indonesia and Bangladesh. And I'm a super stellar panel we have to discuss these important topics. Obviously, Pak Andi Dulung, who's been at the forefront of implementing the response to COVID-19 in the country. The Ministry of Social Affairs has been the key ministry charged with implementing the country's social assistance programs, and these are widely acknowledged to have been high in both quality and indeed reach. Then, of course, we have Pak Pungi Sumadi, the Deputy Minister of National Development Planning and for Population and Labour Affairs, who has been at the front of Bappenas's work on transforming G2P under the G2P 4.0 vision. And Bappenas has been doing a tremendous job of bringing all the stakeholders together to make the delivery of social assistance more beneficiary-centric and more efficient. And we at MSC are deeply privileged to be working with Bappenas and indeed the World Bank and CGAP on this. And of course, in the context of the World Bank, we're very honored to have Ibu Satu Kakonen, the country director for Indonesia and Timor-Leste of the World Bank. The World Bank has provided key thought leadership and implementation assistance for the government to people, the G2P payments, not only in Indonesia, but across the globe. And finally, Michael Wiegand, the director of Financial Services for the Poor program at the Bill and Melinda Gates Foundation, which is spearheading groundbreaking work to ensure that the digital financial revolution is inclusive. Our special thanks to Pa Michael, who is calling in from Seattle late on his Sunday night. So for me, it's very, very early in the morning, and for Michael, it's way past his bedtime, probably. So thank you all for joining us. I really appreciate it. We have 4 topics, and I'd be really grateful if you would answer the questions I give you within a 4-minute time period, so that we have enough time for our audience questions towards the end of this webinar. Our first topic is Indonesia's experience in handling social assistance program during the pandemic. Indonesia, with a population of 268 million people, suffered its sharpest downturn since the 1998 financial crisis, as the COVID-19 pandemic shut down large parts of the country. As we heard, GDP contracted 5.32% in the second quarter, and a recent study suggests that the pandemic may result in 8.5 million people falling into poverty, thereby wiping 10 years of progress on poverty reduction. And to mitigate this impact, the government of Indonesia has allocated about 700 trillion rupiah, approximately $50 billion, of which about a third is for social assistance programs. So a very substantive response. Andy, I'd like to start with you and ask, since the onset of COVID-19, the government of Indonesia has launched several new programs and modified some of the existing G2P programs. In 2 of the largest social assistance programs, PKH and Kartu Sembako, more than 5 million new beneficiaries were added, and also the entitlements for each beneficiary under these programs was increased by about 25%. Can you elaborate on the overall strategic direction that the government of Indonesia is taking with these two flagship programs, the achievements so far, and the innovation in delivery mechanisms for cash transfers and in-kind food subsidy? Bye, Andy.
Okay. Can you see my presentation in here? Hang on, the present. So, okay. Oh yeah. Okay. Thanks. So since we know Indonesia is suffer with this, we call it here is disaster. Oke, aduh, mana presentasi saya ya? Kok? Yeah. Next. Yeah. So see, Indonesia is we can say that's number 22. The problem with, and we see the disaster increasing. So the government take action. Next. You can see it, but that's COVID-19 and poverty is incidence. You can see here that's from time to time increasing the problem, and we try to make a image of the new port. So we try to make a new mechanism how to deliver the aid as soon as possible, so we can deliver the aid to the or cash assistance to the public. Next, please. This is the data we find it that there's so many people we suffer with this disaster. And next. And the government try to preparing around 203.9 trillion. As you said, that's we have two regular program. One is BPMT or food stamp, and one is the PKH, Program Keluarga Harapan. Program Keluarga Harapan we increasing 5 million to become 10 million household as a beneficiaries, and for BPMT or food stamp also we increasing to become 20 million. Besides that, because still we have still a lot of people that suffer from this disaster, so we increasing also that any other program that conditional cash transfer, and we divide by two, one in surrounding Jakarta, and one is outside of Jakarta, which we give cash. Surrounding Jakarta, we give food stamp, so they can receive it food. And another program also, this is outside of the Ministry of Social Affairs, the government preparing also for electricity electricity bill, which we give free for 450 watt, and other program we just launching on June, that's food stamp, rice subsidies, special for the beneficiaries of a program Keluarga Harapan. So all this one will cover until December. So, and another budgeting also is from Village Fund. We preparing that one. If still any people don't get from the other program. Next, please. So all delivery of this program, we depend on DTKS, which now we have a DTKS, we have 27 million household, consists of 27 million household, 29 million families, or 97.3 million individuals. %81% of people in the TKS is registered in Dukcapil. So we have a matching already, all the data with the Dukcapil, and then we get the specific number, NIK. So we matching the NIK in our data, the TKS and Dukcapil. And now we continue to updating for next year. We will updating all the data, even we increasing from 97 million to become 120 million. So this is the key of success of delivery of cash, also delivery all the aid to the people. Program to overcome the impact of Corona. Next, at the last slide. Next. Yeah. So this is to ensure that the people are safe from COVID-19, to reform the healthcare system, to increase people purchasing power. Yeah. So with cash of transfer, we hope that can increase people from purchasing power, and to increase state revenue, to prevent employment termination. This is the goal of the program. The role of G2P, government to public program, in response to COVID is to accelerate the disbursement of assistance and the right target. So this is take special policy for non-DTKS families who are affected by COVID-19 to get the social assistance and to be in DTKS. Another thing, we have to strengthen in coordination with other ministry and regional government related to the targeting beneficiary of social assistance and data collection mechanism. Strive the assistant leading to the bank services, because we use all by bank system. So the COVID-19 pandemic is one opportunity for Indonesia to improve the TKS, data in planning, massive verification and evaluation in 2021. So hopefully with finish next year, the TKS with updating 2021, and we can get more updating data, new data, which can affect it to more good targeting for the social assistance. Thank you.
Thank you, Pa Andi. That was very, very helpful and leads us neatly to the second topic, which is addressing the channels of the challenges of targeting, identifying and onboarding new beneficiaries. And I think this is something that every country has struggled with. There is such a huge number of newly vulnerable poor in the communities. And I know that the government of Indonesia has taken multiple measures to provide a social security net for the most vulnerable sections of the population. As you've discussed, in addition to PKH and Kartu Sembako, you've launched a series of new programs. But you've had to face this challenge of identifying, targeting and authenticating new beneficiaries for these social assistance programs. And I wonder whether Papungi, you could talk to us a bit about how the pandemic has compelled so many countries to expand their social security programs to these new vulnerable sections of society. But this has posed great challenges for governments across the world. And I wonder what measures the government of Indonesia has taken to ensure effective targeting and identification of new beneficiaries. Papungi.
Thank you, Graham. The poverty database system that we have, that Pak Andi was telling us previously, was covering about 40% of the bottom Indonesian population. And then we've been asking the local governments all over Indonesia since 2015 to update the data. But to tell you the truth, it is politically unattractive. Because why should I spend some money to improve the data, which I don't know what to do of the updated data for my political purpose? Now we are in a situation where the accuracy of data for delivering the social assistance programs, especially during pandemic, is very important. Now, having this situation, what we do actually, we cannot work alone by local government and the central government. What we ask is the community to really participate in updating the data. Yeah. So by doing this, we ask the community leaders, local officials at the village levels, and the program facilitators that, for example, the PKH or the food subsidy programs are having, to really work together and really identify and acknowledge, okay, this is actually the existing beneficiaries. This is actually the new group of people who are impacted now, and then how we can deal with this. Yeah. So by working with the community and local officials at the lowest level, we are able to update the data. Okay, this is actually set aside whether it is accurate or not. That is actually another issue, because during this situation, actually, I cannot imagine that the local officials will be able to use certain criteria provided by the statistics office that they should meet this level of income level. Yeah, we cannot do that because of the timing and the situation. By doing so, actually, we can expand the numbers of beneficiaries based on the government decision on to provide the social assistance. But on the other hand, we are working very closely, Bappenas Statistics Office and many relevant ministries, to work on how we can improve the poverty data for the future. Yeah. So we are looking at, actually, for example, the socioeconomic census, the population census, the socioeconomic surveys that the BPS is working now. And then we are trying to really set up, okay, maybe this is actually the new poverty line. This is actually the new characteristics or criteria that we need to put into the next selection level. So by working on this methodology, yeah, we are preparing how we can better improve that is scientifically and academically will be more accurate. That will be implemented sometime mid next year to get the new poverty data, and we will expand it not only to include the bottom 40%, but also the 100% of the population, because we believe, yeah, in the future, Indonesia will not be prone, will be very sensitive to natural disasters. It is not only natural disasters, but also health disasters like this. So we need to understand who are the people from the number one, the lowest level, up to the number 260 million at the highest level. So we can have more understanding on how we can define our strategy to deal with the pandemic situation or even natural disaster situation. So this is actually the main idea, how we improve the data. Thank you, Graham.
Brilliant. Yeah, sounds very exciting. And of course, leverages the very powerful local village committees that you have across Indonesia. Perhaps now if I could turn to Ibu Satu. The World Bank has been working closely with the government of Indonesia on its G2P 4.0 vision that is targeted at transforming government-to-people delivery and making it more efficient, inclusive, and beneficiary-centric. How is this problem of targeting and identifying the right beneficiaries being addressed as part of this new vision? And also what lessons from this pandemic will feed into the overall design of the future G2P programs in Indonesia? Ibu Satu.
Thank you very much for that question, Par. And I think this current pandemic has highlighted the need for social assistance to reach the people quickly and transparently. So that's basically one key thing that we are all taking out of this pandemic. And G2P payments are key to facilitate that. The other thing that this pandemic has shown, that countries that have advanced G2P payment systems, they have been able to deliver cash to the vulnerable people much faster and much safer than those countries that don't have such systems. And let me give you 3 examples from around the world. So in Chile, and Chile is one of the global leaders and innovators in social protection. I mean, they have used their national digital ID linked accounts to deliver this social support to about 2 million vulnerable Chileans during the pandemic. In Peru, they managed to leverage their very extensive retail agent network to deliver the support both to the old and new beneficiaries. And then if we come closer to home, if we come to Thailand, I mean, Thailand, a lot of credit to them. They managed to capitalize the link between their national digital ID system and also their fully interoperable prompt pay instant payment system. I have to check the name. And that allowed them to basically launch very quickly additional emergency program to a 15.3 million additional Thai families during the crisis. They managed to verify, they managed to pay very quickly to the accounts that these people had that were linked to their digital IDs. And they also managed basically to cross-check and avoid big overlaps. So I think during this pandemic has shown the power of fully developed G2P systems. So let me then turn to Indonesia, because you ask, you know, what are the lessons learned? How has it played out in Indonesia? I mean, Indonesia has managed to deliver the support through its current programs, PKH and Sembako. So they managed to basically get the money to the recipients in a matter of weeks. Very successful. So government definitely, I mean, kudos to them, what they managed to do under challenging circumstances. Tells about the power of the systems that they have. But as you heard earlier, because the crisis has been so deep, a lot of new programs had to be introduced. And that's basically where the lessons are coming in. Because what we saw that with these new programs, identification of beneficiaries, then basically getting them verified, getting them paid has been challenging, because most often they have had to rely on paper forms and face-to-face interaction. Also, given that the the systems, the databases are not fully integrated, it has been very difficult to verify that the programs are not overlapping. I completely agree with what Punki said. During the crisis, you can't basically expect perfection. You want to cover as many vulnerable people and households as you can. But it does basically bring home two lessons for Indonesia from this pandemic. At least that is what we are taking from the World Bank side. So the first lesson to us is that introducing a digital ID and digitizing the process of identity verification and onboarding will be important to do in Indonesia as we move forward. That would basically improve the response time, and over time it would also save money for the government, because this is not going to be the first and last crisis that is hitting the country. Let me mention the second lesson, because it's linked to that. And the second lesson is that it's important to support the interoperability of the databases, because that would then allow very quickly to ensure that the programs are not overlapping. So in short, what I'm saying is that the pandemic in Indonesia has highlighted the need to move forward with the G2P 4.0 as soon as possible. Let me stop there. Thank you.
Thank you, Ibu Satu, and absolutely right. And as you say, I mean, identity and the ability to use an interoperable system, hugely important. Pa Michael, apologies for keeping you waiting so long. The foundation has worked on this issue with governments of many developing countries. I wonder whether you could give us some insights on the strategies and approaches that these other countries have adopted to tackle the challenges related to targeting, identifying, and onboarding beneficiaries during a pandemic. And especially, I suppose, the role of digital ID and how digital ID infrastructure could help streamline this process. Pa Michael.
Great, thank you, Graham. Yeah, and the problem of both targeting and onboarding is a significant problem around the world. It's estimated that the number of individuals receiving cash social protection payments has doubled to almost 1 billion people. So countries across the world are rapidly scaling up their cash assistance programs. I think a number of the speakers have talked about the challenges and potential solutions to targeting. So let me focus on onboarding. Right? This is one of the main barriers to bring people into the financial system. And there's 3 pieces that are commonly used to simplify this. The first is tiered know your customer rule. So the cost of identifying who a customer is, verifying their identity is a big cost driver in bringing people into formal financial accounts. The Financial Action Task Force, FATF, who sets the rules or guidelines globally for this process, had already enabled what they call simplified customer due diligence or tiered KYC. So you can have a much simpler process for small accounts and have different rules for small accounts that are seen to be low risk. And FATF has reiterated these guidelines under the pandemic, and many countries are moving to expand the use of the simplified due diligence to enable people to come in a simpler way. The second, as you said, is electronic KYC, electronic know your customer. And this typically leverages a national ID system. Indonesia's got a great advantage of having a national ID system, technologically advanced, widespread throughout the country. Many countries have really accelerated the use of these ID systems to authenticate people, to bring them into the system in a safe way, but also in a low-cost way. And then the third thing, countries are changing the regulations so that people can onboard themselves, remote onboarding, so that not only is it just faster and easier and less expensive, but in a COVID context requires less interactions. Some countries already had this in place. India's one of the biggest examples. they were able to bring the cost of onboarding a individual into an informal account from around $10 to just a few cents by leveraging their national ID system for authentication. But many countries have really accelerated this work during the pandemic. The Arab Monetary Fund has accelerated guidelines, and that was actually driven by the Arab fintech community. And they've now issued guidelines across a number of Arab countries of how to enable remote onboarding. Jordan has done some really innovative work in leveraging their ID system across a wide population, including the sort of non-citizens that are in the country, refugees and so forth. Another great example are the West African Economic and Monetary Union, WIMU, which is a set of 8 countries that have a common currency. When they accelerated their digital onboarding, they're leveraging the national ID system for onboarding, they've seen the number of new accounts tripled. So just during this year, when these new measures were put in place, they're now seeing triple the number of new people coming into the system each month than what they saw at the beginning of the year. So many countries are moving very quickly to leverage their national ID systems. And there's some great examples out there that Indonesia can learn from.
Great, thank you very much, Michael. And I think that allows us to move to our next topic, which is now, hopefully we've got the ID systems and the beneficiaries onboarded. Now we need to look at the enabling payments infrastructure, including the cash in, cash out agent networks that are essential to ensure efficient last mile delivery of social assistance. Now, as we know, Indonesia is the largest archipelago in the world. 56% of the population resides in the island of Java, but in the more remote islands, particularly of eastern Indonesia, the quality of physical infrastructure required for digital financial services delivery is weaker. And this infrastructure gap, I think, creates challenges for the delivery of social assistance into these remote areas. Now, Indonesia has made tremendous progress with regards to financial inclusion over the last few years, driven by over 100 million financial services agents. These Laku Pandai and LKD agents, as well as the 4.1 million fintech or e-commerce merchants, provide critical digital financial services infrastructure. Andy, as I said, Indonesia is a huge country with 17,000 islands. There's a stark difference between the infrastructure in and outside Java. Given these ground realities, what are some of the challenges in making emergency cash transfers during the pandemic? And how is the Indonesian government tackling these challenges? And finally, I guess, what are some of the long-term implications of these existing efforts with regards to the overall G2P transformation of the government of Indonesia? Andy.
Mute, Andy.
Yeah, since we use technology, internet, and we have some blank spot, that's one of our challenges actually. Yeah. So how to preparing all the system to find a blank spot all in the country also is one of our challenging. We hope if beside that also data, yeah. So data, but data we find that next year we are updating all. So as Pak Pungki said, that we work with the local government also to updating all that one. So I think that one, the two challenging, that's one is face us now and in the future.
Okay. Thank you very much.
Graham. Actually, if I may add,
Please,
how
please,
to reach
Papu.
we used to work with the banking system for the two nationwide programs, PKH and the Sembako program. But recently, because of the pandemic, we also invited the post office because they have very wide range distribution channel across Indonesia. So especially in the remote areas in the eastern part, we asked them to get involved in helping us distribute the benefits as well. So that's actually another new element that actually we introduced during the pandemic situation, Pak. Thank you.
Yeah,
Thank
that's
you.
right. Especially in kind, yeah.
Especially in kind. Oh, interesting. Okay. Yeah. Because certainly that we have similar situation in India, where the reach of the post office is so extensive that it's played an important role in remote areas. Great. Pa Michael, let me turn to you again to ask, because the foundation has been such a strong advocate for promoting inclusive payment systems, in the light of the pandemic and the importance of self-functioning and inclusive retail payment systems is quite clear. But what is the foundation's overall strategy on this issue, especially in the context of COVID? What policy levers should be or could enable more efficient payment systems and KICO, cash in, cash out agent networks for delivery of social assistance at the last mile?
Yes, and we are seeing some dramatic increase in digital payment and digital transfers during the pandemic. We're seeing that in India, Bangladesh, and in many other countries. That said, still the vast majority of payments in most of these countries are in cash. And so really to make sure that these systems don't exclude people and allow them to get access to the goods and services that they need, being able to move these digital funds into cash, convert them into cash is critical. And that's the most difficult part of these systems. It's estimated for a lot of these payment systems, 60% of the cost is in these agent networks or whatever mechanisms are to allow people to access cash digitally. We see three key areas that have been able to unlock and enable much more cash access. The first is just expanding the type of entities that can provide these services. So going beyond traditional financial services, traditional branches, to allow a wider variety of entities to provide cash in, cash out. But he mentioned post offices, and you said in India, this has been a big advantage. It's something that's really accelerated significantly during the pandemic. But other types of businesses can be leveraged. Indonesia has the advantage of a really thriving fintech industry. It's very active in Java, but it's starting to make inroads in other countries, and that's something that can be leveraged. Colombia and Brazil, Jordan have all taken really innovative approaches to allow new types of entities to participate. And again, take a risk-adjusted approach. So by allowing them to do very narrow types of transactions, they can allow a wider range of entities to provide those services. The second is interoperability, so that an agent can provide cash services to people that have accounts with all institutions across the country. And you're seeing that, for example, in India, where the majority of accounts for people receiving social benefit payments are with the state-owned banks, but yet the transactions are overwhelmingly being driven by some of these new, more innovative players like the payment banks. And that's because their system allows that interoperability. You can go to any type of agent and withdraw cash from any type of account. And others, Pakistan is currently in the process of implementing a similar interoperability platform, and that's becoming quite standard. And then the third is thinking about what we call the form factor. So how do people actually access cash? Traditionally, this was done through a card The cards are very expensive, not only to issue and replace, but also the devices needed to read the cards is very expensive. So different countries have adopted different, usually mobile phone-based mechanism for people to access cash, and for individuals to not have any device at all. So cardless access. So using the ID, using biometrics, people can have access to their accounts without having to have any type of device or card. And Jordan really accelerated that over the past year with the pandemic. India already had what they call their Aadhaar-based payment system, but the use of that has really spiked during the pandemic. So those three come together. And then the added thing I would like to add, mechanisms to really test whether cash is available. So you see in many countries, they've got huge numbers of agents. You cited a large number in Indonesia. You often have two problems. One is they're very concentrated in urban areas and not prevalent at all in rural areas. So they don't have cash available. So they may be an agent, but they're not actively serving the customers. And I know that MicroSave, IPA, and others have done some really rapid surveys using mobile phones to monitor whether cash is really available across the country. And that's a really important way to see whether the system is working.
Yeah, I think that's a really good point. And of course, the mass G2P payments that have been made under the pandemic have allowed the activation of a large number of agents. And we've seen in several countries that broadening of outlets for G2P payments beyond just banks to include telco agents and fintech agents and so on, simply because they have such a broad reach. And the banks were struggling with their infrastructure to deliver to the more remote areas. Great. So that leads us neatly, I think, to our Ibu Satu. And you know, we've talked about how Kiko networks, the cash-in, cash-out networks, are the backbone of any emergency cash transfer system. Based on the World Bank's work in other countries, as well as Indonesia, can you throw us some light on the measures that service providers can take to support these cash-in, cash-out networks during such difficult time? How do we ensure that these networks remain operational, adequately motivated, and indeed, as Pa Michael just said, have the liquidity to provide the cash-out services?
Thank you for that question, Pa Graham. I mean, let me first touch a little bit the issue of how to expand the Kiko networks in Indonesia, because at the moment in Indonesia, not all agents can do Kiko activities because of regulatory constraints. So, I mean, first of all, to expand the Kiko networks here, there would be a need to relax the regulations. Currently, it's only basically state-owned banks that are authorized to do that. And that means that it's only the Kiko agents below them that have been able to operate. So relaxing this and allowing also other banks and other players to come in would basically provide a wider set of services to the consumers. So that is a relatively simple and quick and easy way to expand access for people. Then I do want to go to the issue you said, the remote areas, because this is the problem, in particular in Indonesia with the thousands of islands. And it's very difficult, obviously, to get the financial service providers to go to a remote area, so to small islands, because they have to cover their costs. It's a business decision that they will have to make. So if basically the government would like to expand this, the Kiko agents to the remote areas, it would require some financial incentives at the beginning. Then as the networks expands, the demand increases and it becomes more mature, these financial incentives could be pulled back. But at the beginning, it's unfortunately the case that something would be needed to facilitate that expansion to remote areas where the needs are now the biggest. Now, then the question, how can the Kiko agents survive during the pandemic? And that's a $60 million question, because there's no straightforward answer. But I mean, from our point of view, the short answer is basically expanding from cash to digital transactions. So right now, the Kiko agents are mostly, they are individual agents, and to getting the service requires face-to-face social interaction. A safer way would be then to move away from purely cash transactions, but also to digital transactions. And what that would basically mean is that there would need to be a system that would allow using co-pay or debit card at any ATM, at any store, at any merchant, because that would very quickly then facilitate access by the people. So realize, I mean, it's not the easiest, but what we have also seen during this pandemic, that overall the enterprises that have been flexible, that have basically shifted very quickly to work on an online basis and in a digital manner, they are the ones that are surviving. So unfortunately, it's the same for Kiko agents in this case. Let me stop there.
Yeah, thank you. And some great observations there. And I think one of the things that I'd like to add on very briefly is that across the world, and actually particularly in island nations, we see informal agents operating at the periphery. And so that actually presents a significant risk in that, frankly, they charge whatever they want to do cash out. And it seems to me that it's always worth looking at expanding the formalized agent system as effectively and as broadly as possible, because the moment you leave those white spaces, the empty unserved spaces, the informal system will pop up and serve it. And then you have no control over the risk associated with that service. And we've certainly seen that in the Philippines and even in places like Kenya, which we associate with, you know, wall-to-wall coverage of Kiko agents. So perhaps we'll move on now to our final topic. And this final topic is about the vision for transforming social assistance delivery in Indonesia, and the concerns and opportunities for delivering social assistance in the new normal. And I was really impressed to hear both Pa Andi and Pa Pungki talk about how this won't be the last, sadly, the last emergency that we have to face, and how we have to build the digital infrastructure to respond to these emergencies in a prompt and efficient manner. And while COVID seems likely, sadly, to go on for a long time, individuals and businesses have already started to adopt and adapt to the new normal, a term that has been used across the globe to predict the future in a post-pandemic world. Now, Indonesia is already witnessing significant growth in its digital economy, which is estimated to be worth about $130 billion by 2025. And I feel, in common with across the rest of the world, the pandemic is likely to boost these digitization efforts. But while digitization will play an important role, it is vital that we do not lose sight of the vulnerable communities, the other side of the digital divide. And also, and in particular, I think, to ensure that women are not left behind. Pungi, could you elaborate on some of the key building blocks of the overall G2P 4.0 vision that Bapanas is championing, especially with regards to enabling beneficiary choice of payment instruments and service providers? And how do you see the opportunities to leverage non-bank channels for social assistance delivery, especially in the context of the pandemic when private-public partnerships may be required?
Okay, thank you, Pak Graham. I think I would answer the last question first by involving the non-bank service provider. Yes, we already re-invited the office to get on board with us on delivering the benefits for social assistance during the pandemic situation, and that will be continuing for the future programs. And the building blocks, but what we are going to think to do is actually we need to identify and acknowledge the needs of the beneficiaries. Okay, maybe I'm more comfortable with the ATM, but maybe the others will be more comfortable with the pawn shop because it is just next door of my house, you know, things like that. So different kinds of needs, we will try to identify and acknowledge that. And then for that one, we need to have some kind of the support system who is going to identify and verify that actually this group of beneficiaries will be able to receive the benefits from the pawn shop and the others will be from post office, things like that. So there must be somebody who can tell us and verify the information that we need to include them within our channel and distribution system. And then the third one is actually we need to promote the better KYC, know your customers. Yes, we have the biometric systems. Our single identification number has reached about 98% of the population. But then how we can use that information, we use the system to enhance the eKYC system. So that will be actually by integrating all the players, demand side and the supply sides, all the financial service providers to talk about how we can use this issue to have a better payment system. And we need also to integrate between the non-banking system or with the banking system. For example, the digital gyro account from post office, is it connected with the banking system? If it is not, how we can do that? So maybe this is actually the issues of regulatory improvement that Ibu Satu mentioned earlier. Now, the next building block is actually improving the IT systems. Yes, we have the West Palapa ring or satellite ring connection, the central one and the eastern one. But how we can make it into real operating system that everyone can get benefit of it, so that actually interconnectivity among each other in anywhere we are in distributing the social assistance programs is actually reachable. We can help them get the benefits wherever they are, whether it is actually online or offline. That is actually another issue, but at least the interconnectivity among beneficiaries and the providers should be there as well. And the last thing that I think we need to do is keep promoting digital literacy. Yeah, because not everyone will understand how to use the cell phone. I cannot use my cell phone for all the services it is available. They are available in my cell phone. But at least for social assistance programs, we need to have someone who can help the beneficiaries, especially in the remote areas, to get access to the service we are providing them. So these are all the 5 building blocks that I think we will work in the future, Pak Graham. Thank you.
Brilliant. Great. Yeah, no, this makes a lot of sense. And I think your 4.0 vision for G2P is really inspiring, really inspiring. So Pandi, effective communication and grievance redress is critical to the success of delivery of any assistance program, and particularly with vulnerable people, they need to be able to ask questions. How did MOSA modify its existing systems to ensure that communication and beneficiary redress were available and supportive during these difficult times? And what are the main concerns of beneficiaries, and how did MOSA field teams help to address those beneficiary concerns? Andy.
Yeah, so as I say earlier, that we have the data, the TKS, and more the data that's what like now like PKH, we had another benefit there that's for disabled people and elderly also, including there. That actually is not related to the directly to the PKH, but that one is how to deliver assistance, how to deliver cash is easy with the data and the families inside of the PKH component. But sorry, what I want to raise is one edit for Pak Pungki, that's digitalization is we are going to cashless, okay, in order to efficient. The problem is now we start 2016 for deliver digitalization of, but with bank, we deliver digital deliver inclusion, financial inclusion. But when they get the money in digital, because there is no massive for digitalization, so they need still cash in order to buy something, to spend something. So I think if you can make it the whole digitalization, not only the beneficiaries of PKH, or sorry, the beneficiaries of social assistance, that one, but also for the whole system, and this one will go for easy, and everyone using the real cashless. I mean, they get the money in digital, and then they can spend it also in digital. Did I get it right?
Creating a whole
Yeah.
digital
So that
ecosystem.
we hope we go not only the population of not the low income people more digital than the high income people, in especially in the village. Or yeah, that was Graham.
Yeah, no, I mean, you've just outlined the vision, what everyone would love to be able to achieve, but of course it's proving much more difficult because vulnerable communities and often do not understand how to participate in the digital revolution that is ongoing right now. So it is a struggle, and that's why I think communication, even of basic government payments, is often very challenging to these more remote areas and vulnerable people. We did a study in India, for example, where really only about 50% of people fully understood the benefits that were available to them and how to access them properly. So, this is why I was interested in what sort of communication the Ministry of Social Affairs has done in order to ensure that the vulnerable communities access their payments.
Yeah, I think besides that, you see, according to the data, that's our beneficiaries now also is regeneration, and then the newcomer, the millennial now is the kid in the field. They handphone is not luxury anymore. I mean, and then also I think Microsoft also get what survey 2 years ago that said that 70% of our beneficiaries using handphone. Yeah, maybe it's not a sophisticated handphone. I mean, but at least they use handphone. They know.
Yeah.
Similar last time when we want to start also, and then 2016, we are worried that is it possible the local people can understand in ADC, understand how to use ADC, how to use a card, and then only 1 year they understand everything. So I think
Right.
we have to try that. And then I big hope, because the new generation also will be coming in the our beneficiaries, and then they are understanding the technology.
Right. Okay, very good. Well, thank you so much. Let me now turn to Pa Michael and talk briefly, I mean, again, around the world, as I said, one of the main concerns for policymakers has been how to ensure that women are not left behind in the new normal. And there's a concern that I think we at MSC share, is that the lack of equitable digital access may further widen the gender divide as the focus of governments shifts to building that robust digital economy that Pa Andy talked about. How should policymakers adopt their G2P delivery mechanisms, adapt their G2P mechanisms so that women are not left behind as the digital economy takes off? Pa Michael.
Yes, it's a big problem, and it's really been exacerbated by the pandemic. We've helped fund surveys around the world about the impact of the pandemic on people's lives, economic lives. And in every country, women are disproportionately hurt economically. There's one study, roughly 39% of the global workforce are women, yet more than half, 54% of job losses are for women. And so they're just really being hit. You really need to make sure that women aren't excluded. And it is a big risk as we start to digitize some of these programs. More often than not, women are disproportionately hurt by that. There's two ways that we've seen governments address that. One is by specifically targeting payments to women, and a lot of programs are specifically made not only to households that contain women, but into the women's accounts themselves. And there's some really strong evidence that when they have control and agency over that money, there's tremendous benefits for the entire family that can result from that. Some countries have also, on broad programs, given more money to households that contain women or women-headed households. In Togo, it's been one of the sort of on the forefront of doing that. So how you target the payments is one piece. But the second piece is design, really understanding what are the particular barriers that women face, or how do women interact with the financial services, which is generally different, and you need to really understand it. It can be around mobility, their ability to travel to an agent, so maybe you need more close agents. Sometimes there's a real gap either in phone ownership or certainly in smartphone ownership. So if you're designing a program around a smartphone, you need to make sure that women have access. There's no one solution that works. It's really about making sure you understand what the needs of the women are in your country. Indonesia has done a great job. It's one of the relatively few countries that doesn't have a gap in financial inclusion. Basic account ownership is roughly equal between men and women. But when you get deeper into deeper usage and wider products, you start to see the same gap that you see around the rest of the world. So it's making sure you have the data disaggregated as you're doing your surveys to see who's able to get access to cash. Make sure you track for men and women, because that will start to highlight design problems that are disproportionately affecting women. And then it's really just understanding what the particular barriers that women face and make sure you design the program to address those specific barriers.
Yeah, and the Gates Foundation has a 3D framework that is very useful in this context, and I would encourage people to look at that if at all possible. We at MSC have found it very useful over the years. Ibu Satu, final question for you before we go to audience questions, and then after that we'll have a brief wrap up. But Ibu Satu, you've interacted with the governments of many developing countries. How do you compare Indonesia's journey with others? What can other countries learn from Indonesia with regards to G2P delivery? And what quick wins can Indonesia take from other countries as it proceeds on its journey to digitize G2P transfers and indeed the broader G2P Vision 4.0? Ibu Satu.
Thank you. Yeah, Indonesia has had a remarkable journey on social assistance in the past decade, and Indonesia has managed to fundamentally transform its system in a relatively short period of time. Because a decade ago, the system was based on regressive consumer subsidies, and now it's basically targeted, it's household-based, and it has expanded very, very significantly. So, I mean, big kudos to the government for all that work. And it's something that it's noteworthy and something that the rest of the world indeed needs to take note of. So what are the lessons that the rest of the world could learn from Indonesia today? We think that there are two lessons. I mean, the first lesson is the PKH. The PKH has now become the second largest conditional cash transfer system in the whole world. So there are lessons from that program that other countries can learn. So that's the first lesson. The second basically area where other countries can learn from Indonesia is the e-voucher food assistance. So Indonesia has also, it's not celebrated as much as PKH, but Indonesia has managed to transform basically its very ineffective rice distribution system to a nutrition sensitive e-voucher food assistance system. And this is again something that would need to be talked about to other countries. And it's an example that other countries could follow. Then let's turn the tables and what could Indonesia learn from the rest of the world? And the biggest lesson at this point for Indonesia to learn, and in particular in terms of delivery system perspective, is the need to implement the G2P 4.0 vision. So this is basically a lesson. I mean, I mentioned earlier that we have learned this lesson during the pandemic. And I think this is a lesson that is basically now coming from the rest of the world to Indonesia. Then what are the quick wins? Because you ask, what could Indonesia do very quickly to basically reach some benefits? And I'm going to mention two. I mean, the first basically quick win would be to develop a national digital ID and also know your customer functionalities. Unfortunately, Indonesia is today the only ASEAN country that doesn't have a national digital ID. I mean, as was mentioned earlier, Indonesia has a great starting point because the Ministry of Home Affairs has this national ID database. So that should now be put into a good use and be harnessed for service delivery. The second quick win I want to mention is basically strengthening the quality of data in the social registry by expanding its integration and interoperability with other databases. Because again, the next time you need to very quickly reach a lot of people, you can only do it if you have the data available. So this is an important time, an important moment in time to turn the attention to that. I do want to mention something in closing because we on the World Bank side, we are very, very, very pleased to be working with the government on these issues and in these areas. And I do want to mention, because we have the Gates Foundation also participating in this event, that we are very greatly value the generous assistance that Gates Foundation is providing to our ID for development, ID4D program, as well as the G2P efforts. And these are very critical for Indonesia at that point. And any support to those efforts are very much needed. So big thank you.
Thank you very much, Ibu Satu. And on your list was not the extension of the agent network. I'm going to take that as an implicit third. Is that fair?
Yes, because I mentioned it in my prior answer. I didn't want to repeat it. I wanted to repeat basically the G2P 4.0, but absolutely extension of Kiko networks, very important.
We've got such a wonderful infrastructure of sort of, lined up and ready to go. Yes. Putting the risk management components around it obviously is key, but once that has been done, I think that provides a tremendous opportunity. So what I'd like to do now briefly, we have 25 minutes left. What I'd like to do briefly is take a couple of questions from the audience, and then I'm going to come back to all of you for final thoughts and comments. So I'll just warn you in advance so you can be mulling over your final thoughts and comments. But let's go to some audience questions, because we've had some very, very interesting ones. And some of them are specific to some of the panelists, and some of them I think are more general. There's one question for Papungi. Is the cash for transfer program, so PKH and BPNT, are they going to be permanent programs for the central government, or will they be time bound? Papungi.
Thank you, Pak Graham. For the time being, the cash transfer programs, the two programs that you mentioned, are still important for us, because actually what we need is to make sure that actually everyone who is impacted, especially during the pandemic, and the further policy that we are going to do is actually to abolish the extreme poverty numbers in Indonesia within the next 5 years. So actually these two programs are still important for us to maintain. But then again, if there is time limit for that, we will evaluate, because we don't want to be in a hurry to decide actually this will end by year X something. No, we don't want to do that. Yeah. So that's actually the thing that we are thinking now.
Very good, very good. And a great vision, of course. Ibu Satu, I have a question here, and I'm intrigued actually where it came from. It says, we are facing a problem with the supporting system to implement digitization of the system during the pandemic situation in remote villages. Kindly advise us on how to improve the current condition to move forward. I think I'm going to ask Ibu Satu to start with that, but perhaps we can ask Papungi as well to add his perspective. Remote villages, what do we do?
Yes, and that is a challenge, because if you start digitalizing in the middle of the crisis, in the middle of the pandemic, it's not going to happen fast. And this is basically the dilemma here, is that what can be done under the current pandemic to serve the people is somewhat different than what should be done in the future. So what we are telling our counterparts in the government is that this is the time to prepare for the next crisis or the next pandemic, and put the systems in place, because, for example, expanding the internet connection, expanding digitalization is going to help in the next crisis, but it's also going to help in between. So I'm a very big believer in basically in telemedicine, on online learning. And this is one of the issues, for example, in education. We were discussing very much with the Minister of Education what to do. I mean, there are students in particular on the Java island and in Jakarta who do have access to internet, who do have access to online learning. But then when you go outside, it's not necessarily available. And therefore, I mean, the government had to rely on some pretty basic techniques, introducing educational program on TVs. And the surveys that we have done to assess what's done, there are people even relying on the cell phones, on WhatsApp and phone services to try to get some information out. But so unfortunately, there's no quick solution in the middle of the crisis, but we should all start working for the future right now.
Pak Pungki, or anything to add to that?
Yeah, I think I support the idea, and I also explained in my previous in the previous session that actually the 5 building blocks that we are going to do is actually the thing that we are going to prepare ourselves in the future. Yeah, and then we will be able to identify actually for especially on the remote areas, in the rural areas, especially in the eastern part of Indonesia, what kind of the best solution to deal with that situation. Because actually up to date, I'm still getting information from my postal agents officials that actually they need 3 days in Papua and in Sulawesi to reach a certain village. How do you deal with that? If you are relying too much on the digitalization, the internet connection is still not there. So that's kind of the combination that we need to think of. Yeah. So it is an offline system, and then we use some kind of the connection available there to put it into the bigger system so that actually everything will be supporting each other. And of course, the idea of reaching out as many Indonesians as possible is actually our agenda. So this is actually the thing that we have in mind. Yes, we need to prepare ourselves for the future, and it starts from actually not only today but yesterday, Pak. Thank you.
Very good. Thank you very much. Pak Andy, do you have anything to add to that? I mean, the Ministry of Social Affairs has done a fantastic job on this, but remote areas must have been a real challenge.
That's our challenge now. So we do it our best.
Yeah. Okay, so next question has been directed to Pa Michael. To enable last mile distribution of these cash transfers, generally, which agents bear the transaction costs? Is it best practice to put the burden on the receivers or the payments industry, the banks and the fintechs, or the government?
Yeah, and this is a sort of a tension that needs to be balanced, right? I think as Ibu Satu said before, it's important that these agents earn money from these transactions. If you want to have a widely available agent network, they need to be compensated for the costs. But you don't want to put an undue burden on the consumer that has to pay to have these taken out. In many countries, you've seen either by industry or by regulation, a zeroing out of fees to consumers for small transactions. So if you're taking out a small amount of cash, in many countries that has been reduced to zero, but the agent still gets paid. And in most cases, it's actually the financial services company who makes those payments. They make money sort of from other customers and so forth and can subsidize the small transactions. In some cases, it is done through the government. I know in Pakistan, for example, the social protection program, when they make the payments, they pay a small amount to the financial service providers to cover the costs so that the recipients don't need to cover it. This makes sense because by digitizing these programs, typically the government is saving significant amounts, right? There's a vast amount of leakage and other costs of administering old traditional physical cash-based programs, and they're saving a tremendous amount of money. So if they can use a small amount to actually pay for the agent fees, that could be worthwhile. And I know there was sort of a similar question around what the fees typically are. They do range from country to country. We do see that countries that have real competition, have a vibrant environment with multiple providers that can serve customers, the cost to consumers generally comes down quite dramatically, which is what you expect, and the evidence bears that out. So really driving competition and interoperability can also drive down those costs to consumers.
Yeah, that makes a lot of sense. I think have seen it's increasingly common in these current situations for the government to choose to pay. Not least of all because if you rely on the private sector, again, they're less likely to go to the hard to reach areas in order to make those payments. So we've seen two, I think, trends. The first, as Michael said, was to essentially government diktat to eliminate fees on low value transactions, to encourage that digital transaction that Pa Andy was talking about, where people can buy things digitally as well as just receive and immediately cash out. But also there's a tendency for government to say we must pay the fees for the agent cash out services to ensure that those are provided optimally across the board, not just in the population dense areas, but in remote areas as well. And indeed, we even see some countries with differentiated agent fees depending on whether they are in urban or peri-urban or remote settings. And I think that has helped drive the infrastructure as well, because we see a significant increase in the number of agents being made available, because private sector players see an opportunity to set up agents where previously it wasn't real. So let me turn to I think what is our last question, which is directed to both Ibu Satu and Pa Michael. Based on the experiences from other countries, how do countries deliver social assistance to elderly people and people with disability? So I suppose here we're talking about people who perhaps can't get out even to agent networks. How has that been managed in other countries? So particularly vulnerable people. Ibu Satu, okay. Would you like to start us?
Yeah, why don't I start, and then Pa Michael can say everything that I didn't say. So I mean, first of all, I mean, in many countries that have, in particular those countries that have, you know, more developed G2P payment systems, I mean, using the digital system, using the digital payments is a great equalizer, because that will allow then elderly people, disabled people, basically get the money directly to their accounts, in particular if there are digital IDs available, and they will immediately then get the money to their accounts. So I mean, typically, I mean, that's what's done to facilitate also their access. Now, beyond that, when that's not available, I mean, this is then a much bigger challenge, because then the systems are not equipped to deliver separately, typically to the elderly people or disabled people. So either the social service agents will need to get involved and basically take the money to the people, or then the postal service is used to deliver that. But it's an issue, and that to me highlights again the reason or the need for Indonesia to move to the next level in the social assistance delivery, because it would be a great equalizer across different segments of the society. Let me stop there and let Pa Michael then say everything that I didn't say.
Pa Michael.
I think actually Ibu Satu really got the main points that I was going to share as well. I think for both the elderly and for the disabled who are maybe even less mobile than others, all of the same tools and systems and approaches that we're advocating broadly for the population are even more important. And we do see in India, where the Postal Savings Bank has significantly scaled up their direct delivery of cash to homes, that's particularly helpful to the elderly and to the disabled. But digital is particularly helpful to that population.
I can't leave this question without turning to Pa Andy, because he must have faced this problem. Pa Andy, how are you addressing this problem of the elderly and disabled? Oh, we need Pa Andy's microphone on.
Okay. Yeah,
Thank
so
you.
we have two categories. One is living in a social assistant house, social housing. And then one is in the families. Okay. So in the families, as I said earlier, that we put together with the PKH program. So it's easy to deliver the assistant, case assistant with the families. Okay. So maybe a little bit different culture, yeah, with the Western and Eastern, because mostly elderly and elderly people here still stay with the families. Yeah. So they're living with the families. So that's make easy for us to deliver with the program, another program PKH. I mean the PKH also including inside there to deliver the cash transfer. But and for social housing, of course, it's easy because there are assistants there.
Yeah. Thank you, Pa Andy. Right. So time for wrap up. What I'd like to do is go around and just have your final thoughts before I thank you all for what has been a tremendously informative webinar. And I'm really grateful to you all for participating. Pa Michael, would you like to start with your final thoughts and messages?
Sure. I mean, the COVID pandemic is undoubtedly causing tremendous economic harm throughout the world and may well drive hundreds of millions of people into extreme poverty. Like you said, setting back efforts by a decade or more. We do see, though, some potential to come out of this stronger. We think financial inclusion and access to a wide range of financial products is an important tool to help people move out of and stay out of poverty. And through these social protection payments made digitally and made in a way that really enables broad financial inclusion, we think that more and more people will after the pandemic, will have access to better financial products, which will help them. So we think there is a small silver lining to the work that's being done. And I think Indonesia has a great opportunity to develop a really competitive, thriving, and innovative financial services industry coming out of the pandemic.
Super, thank you. Ibu Satu, final thoughts.
Yes, so crises are always doom and gloom, but they are also opportunities for change, and they are opportunities to build back better. And Indonesia has now an opportunity to build back even better in social protection. So basically, this is an opportune time to indeed look seriously in the G2P 4.0 vision and move the country yet to the next level. But what I would like to say in closing is that technology is only part of the solution. what matters most is the government's commitment and government's ability to drive change. And if I can have a situation where these two come together, so technology and the government's commitment to change and improve, I think, then we are in a good place, because that would allow Indonesia to stay or continue to stay at the cutting edge in the area of social protection. So I look forward to seeing that happening in Indonesia in the coming years.
Thank you very much, Ibu Satu. Pak Ponggi, your final thoughts, sir?
Yeah, I think it's important to push the G2P payment system further, according to the latest available financial technology system available. And expanding the fintech support system is actually what I think is more important than digitizing ID system, since actually Indonesia has covered almost 98% of Indonesian population with a single identification number. And so that's why actually I believe that actually the 5 pillars that I explained earlier, identifying the people, creating the support system, and then matchmaking between the supply side and the demand side, and also keep promoting the digital literacy to all Indonesians are very important for us to do so. So I believe that actually starting now, actually since yesterday, we are ready to move forward to enhance the G2P system. Thank you, Pak Graham.
Thank you very much, Pak Ponggi. Pak Andy.
Yeah, I think just short talk that this pandemic is give us a lot of experience. I mean, give a lot of we can learn a lot from the situation, even though we cannot get many innovative because it's very short, but we're preparing something for the next year, and then also for the new normal next, because must be changing the system. So we're preparing from now is for the good serve to the public. Thank you.
Thank you very much, Pak Andy. Yeah, no, I mean, I think across the globe, the pandemic has accelerated trends that we were seeing anyway, and accelerated them significantly. And I think Indonesia is in a particularly advantageous position because it had started work on eKYC. It has this extraordinarily well thought through 4.0 vision for G2P. And as Ibu Satu said, this is the basis not just for financial inclusion, but ultimately the digital revolution will encompass education, will encompass health, will encompass agriculture, and so on. And so there's that awful phrase, you know, never miss the opportunities provided by a crisis. In this particular case, I think Indonesia is very well positioned to leverage this pandemic and accelerate all of these digital infrastructure projects that are underway in order to regain those lost 10 years, I think reasonably quickly. Let's hope so. The whole world is going through an awful challenge right now, and one can only hope that the building back better will be done quickly and will be done effectively, and will leverage that digital revolution and all the opportunities that digital revolution provides. My persistent concern in that is the people left the wrong side of the digital divide. And I think that we collectively should pay particular attention to those people, the vulnerable communities, women who are disproportionately affected and excluded. But if we can do that and do it effectively, I would love to be able to look back on this crisis in 10 years, 20 years time and say, this was awful while it happened, but it stimulated a revolution that has persisted and has delivered great good to the poor across the globe. And with those final thoughts, I'd like to thank everyone who has participated, and in particular, our esteemed panel. And we're really grateful to Bapanas for working with us on this webinar. Thank you, Pa Andy. Thank you, Pa Punki. Thank you, Ibu Satu. And of course, Pa Michael. Pa Michael, good night and sleep well. And for the rest of you, have a great evening. Thank you very much indeed. Goodbye.
Thank you.
Thank
Bye-bye,
you.
everyone.
Bye-bye now.